flags about your therapist that you should know about if you are hypermobile. Number one, it's so important for you to realize that not every rehab clinic or clinician is equipped with what it takes to treat hypermobility. Hypermobility is not something that anyone is taught in school, at least not yet. So we end up learning about our hypermobile patients by treating hypermobility. So when you go to a regular rehab clinic, physical therapy, chiropractic, occupational therapy as an example, you are not going to get the kind of therapist that is going to know about the nuances that exist with hypermobility and hypermobile individuals. So it's very easy to involuntarily, without any bad intentions, to proceed to do what we know, treating whatever the area is, just to end up hurting an individual. You have no idea how many patients I see in my practice, and my practice is primarily hypermobile individuals. I do developmental kinesiology exercises with my patients, and that is why it's such a popular clinic with hypermobility. I can tell you that I see a very large number of patient population that are here because they were hurt in other offices, not because the therapist was not a good therapist, but because they did not know how to treat hypermobility. Frankly, they didn't even know they were treating a hypermobile individual, saying, oh, you are very flexible. Flexibility and hypermobility are not the same, because with hypermobile joints, we're dealing with unstable joints, and that's a whole different animal. So the red flag that you want to look for is that you walk in and there is nothing done about your hypermobile joints. There are no questions. The exam is just a generic physical therapy or chiropractic examination. Now, when I say chiropractic, because when it comes to chiropractic, there are many rehab chiropractors out there that are just like physical therapy. You wouldn't even tell the difference, with the exception that in those offices, you can also get adjusted, which is not something that happens in a physical therapy office. So a rehab clinician is what I'm referring to. So you walk in and the examination is for functional mobility, whereas it needs to be for joint instability assessment. Big difference. So if I tell you to sit down and look for range of motion, your range of motion is just fine. If I look for stability, that's a different set of glasses that we have to have. So you've got to pay attention to that. You start getting your treatment, and every visit is the same. You're given a band, a weight. Oh my goodness. You're given a weight to strengthen a joint, whereas what's lacking is mechanics. Mechanics has to be in place before we strengthen. Look at babies. We start from a helpless infant to running toddlers. There's no bands, no weights, no guidance whatsoever. And yet we go from being helpless and not being able to even roll over to running and doing all the crazy things, climbing and doing all the things that we do. So you gotta understand that strengthening happens when mechanics is in place, and with repetition of following the right mechanics, we get to strengthen the joint. Now, if you wanna up your game more, now you can add resistance to it. It's very important to have strengthening exercises, but not at the point of start, because you don't have the mechanics. The other thing is that you're looking around, and unless this is an EDS or hypermobility clinic, everyone's essentially doing the same thing. You go there, you lay down, you get some kind of a muscle stim or some kind of a machinery connected to you, then they massage you, and then you start doing your work. That is not how it's done. That is not how it's done for hypermobility, at least. And basically, there is no plan. What is the clarity of the plan? What am I going to be accomplished? How often is this, am I being assessed? How often are you listened to? Are the treatments gauged from visit to visit because you can have your flare-up days? Are there any additional pieces of information provided to you for preventative measures? All of those things are red flags because that means you're not in a clinic that knows about your condition. So what's the answer? Exit. Find a place that knows your condition, knows the nuances and the things that can show up, and knows how to manage it. And in my opinion, at least in my practice, my goal is not for people to come here for the rest of their lives. My goal is for them to be my apprentices looking at their issues as projects. In other words, empowering them with what I see, what I would do, what I would prevent, and what I would look for, and transfer that knowledge to them so they can carry on the torch for themselves. So you can't, at least in my opinion, patients should understand what they're doing, not for their shoulder pain and hip pain, but for their overall joint stability. That is the best goal we can have when it comes to rehabilitating joints, maintaining and strengthening the posture, and treating our patients in general. I hope you found this information meaningful to you. I hope you're following me on my social media to learn more about the tips and alerts and little tidbits that are valuable for you to understand about your condition, and for subscribing to the channel. Take care.